about acute neck pain. So this is sort of pain that you've woken up, you've slept perhaps very deeply or in a very awkward position, you've woken up and you've got local neck pain here, meaning that it's very difficult and restricted for you to turn into that. The first thing is to not panic. Usually within a week it will settle down even if you did nothing. So don't rush to take medication or anything like that, maybe some heat on it and things to relax the muscle spasm off, but I'm going to show you a few things that you can do to help it on its way. So as we say, usually the pain is one-sided, meaning that it's too painful to turn and your movement is considerably restricted. The first thing is to don't keep banging it into that pain. That's just going to irritate the joint. The joints in the neck are stacked on top of each other like dinner plates. There's an awful lot going on in a small space. So what we want to do is to release that and turn the head away from the side of pain. Now, in a standing position, because as soon as we sit, we tend to end up in this position, which is going to irritate those joints. So ideally in a standing position, focus your efforts on turning it away from the pain. Visualize that you're opening that side of the joint up and relieving some of the irritation within it. And then every so often, keep just trying to go into it and seeing how that feels. The problem is we've got a very big, heavy head balancing on a very narrow column of cervical spine, and that can cause compression and irritation. So what you can do to release that is to use something like a brick or a couple of thick books to take that pressure off. And I'm going to show you how to do that now. So you have to do that lying down either on the floor or on the bed. And I'm going to come and lie down, and I've got the brick or the book behind my head. Now it's very important that you can see that my neck is hanging free. It's just the edge of my head which is on the brick. And that basically puts my neck in a beautiful dynamic position. It's taken the weight of the head off the neck, so it's not causing any compression to those joints. So you can relax into that position. Some people like to put a hot water bottle or something like that to relax muscle spasm off, and the muscle spasm is responsible for a huge amount of the discomfort that we feel. So you can relax in this position, and then what we want you to do is to imagine you're going to try and tuck your chin in and stretch your neck down, and you can visualize how that's gapping the joints in the neck here and potentially is going to relieve any irritation. So you can just small little bouncy movements releasing that pressure like that, and this position is really good to do if you've got that sort of headachy pain, that kicked in the back of the head sort of ache, and that can really help to relieve that. And you can stay like this really as long as you want. Most people obviously just a couple of minutes, and just keep relaxing the head down and releasing those joints. In this position, it's also really good to work away from that side of pain. So if we're thinking the pain is on the right hand side, just to do small little rotations away from the side of pain, releasing it like that. And that can be very soothing. And then we're doing this with a joint in a beautiful position. We haven't got to the weight of the head pressing down on it, and it's really going to free that up. Do that a couple of times, and then yes, turn into the painful side and just bounce on that edge of the pain. It's a bit like trying to open a stiff drawer. You've just got to gently nudge it and respect the pain, but don't be afraid of it. And this position is the best way to do that in. So you can do that relatively regularly, time allowing obviously, during the day. If we just stand up now, obviously we don't use collars or anything like that now because it encourages neck stiffness and they don't usually fit very well anyway. But if the neck is really uncomfortable, you can use something like a big bath towel, wrap that around your neck a bit like a scarf, and then when you sit, it doesn't allow the chin to protrude, which is going to irritate those joints. It will hold it in a nice stable position, and that will help to relax some of the muscle spasm off. But as I say, usually within a couple of days they do settle well. If you've got a lot of muscle tightness on this side, there's one stretch which is quite nice to do, and it's a combined movement stretch. As I said before, the joints in the neck are stacked on top of each other like dinner plates. I personally don't really like patients doing side movements. That's quite easy to pinch those joints and irritate them. So if we're saying the pain is on my right hand side, we want to stretch out the muscles on this side and relieve the irritation of the joint. The movement I'd want you to do is to first of all drop your head all the way down to the floor. Then look towards the painful side just a little bit, and then with your opposite hand, bring the head down and away from it. And you can visualize how you're stretching this side of the neck here. And like with all stretches, hold that for at least 20 seconds to achieve some muscle relaxation. So just to repeat that, it's head down, slightly to the side, and then away from the pain to stretch those muscles out. And again, do that as often as you feel you can. I wouldn't be rushing towards the anti-inflammatories, maybe some paracetamol if it's really uncomfortable, maybe some heat, maybe using a towel to support the neck. But focus your efforts initially on going away from the side of the pain, relax with it, and it should settle down within a week. Obviously, if it doesn't and the pain gets worse, or you've got associated headaches, pins and needles, all those sort of things, then do go and see either your GP or a physio within reason as soon as you can. Thank you for listening. I hope that helps.